Hi, Dalya.
Hi.
Thank you for giving me this moment to chat to you.
It's my pleasure.
Very excited to hear about not just your work, but also where you come from, because I think that is an area that we often don't discuss. We don't often get to hear, firsthand experiences. And I want to use this opportunity to really focus on your story, the story of your own country. So you can tell us where you work and where you come from.
Yeah, I come from Sudan. We have everything in the country, but unfortunately we are lagging behind. And we have agricultural land, we have animal resources that never found in any other countries. But when to come to the national expenditure, again, it's very low. It's very low. So yeah, in terms also of the health, I think for last 30 years, the expenditure on health, it's not more than 2 to 3%. So that ended up with a very fragile health system, prone to any outbreaks, and even those outbreaks are being detected late after killing too many people. So it's still the country is currently because also the transition not went well. 25th of October last year, there was a military movement that taken the power from the Hamdok government, and currently there is a way of to do that again, a negotiation and a new agreement. But yes, we are still having that hope of a country that we all dream about. But there is too many challenges in place in terms of the economic crisis.
And of course, when you talk about humanitarian settings, countries where there's crisis and protracted crisis, we often then just only tend to focus on military responses and, food security, which are all important. And of course, like you're saying, if there's already underspending on health, 2 to 3% is very small. What have you seen as some of the most pressing challenges that worsens the health system's ability, to be able to get to these targets of ending maternal and mortality rates for children as well?
Yes, I think also this makes the prioritization of maternal and child health is very unrealistic to be the target that we should achieve. Like the human resource for health, we have big gap in qualified midwives and doctors. Despite that, Sudan have 72 medical schools in the country. Yes, but unfortunately, most of those graduates, they just finished the internship program, a housemanship program, and they left the country.
I see that's the other issue around the health force.
Yeah, it's one of the biggest challenge for us is retaining the retention of the human resource for health, and the other issue, the quality of the community health system. And the community health system basically based on community midwives and community health worker, but the two cadres, they are not having that opportunity to be in a government payroll, to be employee, the government employee. So we keep graduating and producing cadres that the government are not here to
absorb them
in the system.
So, Dalya, in terms of the conference that's coming up in Cape Town, how do you see then that space as a potential space to widen the space and have conversations around ethical recruitment of healthcare workers, especially from Africa, right, to support health systems in, you know, high income countries, for example, in that you have 72 medical schools, and yet you are not benefiting as a country, you know, from that kind of investment. What, you know, are you thinking of perhaps other colleagues in other areas in Africa who are experiencing the same problems? I know there'll be some country delegations, you know, what are some of the conversations that perhaps you think are possible for us as, I mean, well, I'm also a doctor, you also a clinician, so we know firsthand the burnout and the stress that comes with trying to do this work unsupported in terms of literal materials, but also, you know, human support.
Yeah, I think the conference will provide the opportunity of learning from the other countries, how, because Sudan is not very different from the other African countries. So few countries have been like go through what Sudan currently in before. I think it will provide the opportunity of like learning from others, and also it's provide the opportunity of echo this African fit for purpose work for health within the globe, like also to find maybe like bundling programs between East, South, cooperation, and so and also it provides space for all of us to raise those kind of concerns, like to be picked up by others, donors, other countries, wealthy countries that are coming to attend the conference.
Yeah. So I think you're quite correct. I mean, especially with COVID, it meant that we couldn't meet and do work as usual. And so reconvening, reorganizing and aligning ourselves as a global community, but with very specific local needs, I think it is going to be a powerful space. Is there anything else that you want to share with us, sort of your, I don't know, your call to action or your overall message?
Yeah, I think overall message, the 2023 IMNHC conference provide that the opportunity of putting MNH back to the top agenda and creating the space for a real mutual accountability where the global community is there with all the tools, the guidance, the how to reach the targets, the knowledge is there, and the country government should be using those evidences to align their national plans with, and to come 2025 having progress on that.
That's amazing.
Yeah. So yeah, I think it's the overall is there is a hope. Yeah. Maybe reaching 2030 agenda if we collectively work together toward that targets.
Thank you so much. And what you've said about mutual accountability is really, really key, and making sure that the issues of maternal health, child health, make it back on the top agenda. So thank you very much, Dalya.
Thank you, Victor.
That was amazing.
Thank you very much.